Today I delivered a talk on the dengue prevention in Hyderabad, Mumtaz Mirza Auditorium, and it was presided by the Commissioner Hyderabad, Fayaz Hussain Abbasi, and was co-chaired by the as a Chief Deputy Commissioner Hyderabad, Zainul Abdin Memon. So the DHO Hyderabad Pir Ghulam Hussain Shah invited me, and I delivered a brief talk on the dengue prevention. And initially, I discussed that dengue was reported in Hyderabad in early 2010-9, and as per my research, the the hot spot or it started from the Tando Aga and Tando Wali Mamad, and the washerman, or we call it Dhobi Ghat, was perhaps the main source, because early morning these activities and working of the people starts and it continues in the daytime. So the fresh water is available and water tanks are available, and this activity is going on. So this was the most affected part in Hyderabad. So I advise that the commissioner and DHO as well as the deputy commissioner should pay the attention to this point, and all such areas where the washing and the dhobi ghats are there, they must be taken care of, so that the breeding and the increase of the mosquito is stopped. Second point was the old tires in the rain, they are filled with the rainwater, and water stays there. This fresh water gives an environment for the dengue. And then I went to the nowadays the mineral water companies and small shops and small uh, containers are being supplied everywhere in Hyderabad. And if you go to one corner to other corner, I think at most 1,000 such water companies are so-called mineral water or clean water company suppliers are there. So their container as well as their operation are related with the clean water, so the dengue can be the, there, and this source can be taken care of also. Then I went to the other points, that even the mineral waters now used by the middle class, upper middle class, and the people, they throw these mineral water plastic bottles, and a little water is also uh, present in these water as a remnant or unused, and ultimately these bottles are also source of. The same is true for the water tanks over the houses, and the other preventions were the, because it is a day biter and it has four varieties: dengue 1, dengue 2, dengue 3, and even the Aedes aegypti and Aedes albopictus 2 viruses are causing this dengue fever. And the monsoon fever is nowadays coined as the common name, in which four diseases are included. One is dengue, second is typhoid, third is chikungunya, and last is malaria. And the Google risk for Hyderabad has been calculated by 68 out of 100 fever cases. If it will go to the 79 or 70, then it will be a high risk indicator, or high risk indicator for the dengue and other fever causing. So post monsoon, the months are July, August, September, October, until November, and then the dengue will drop. So I advise that the campaign of fumigation and all these things will not reduce the transmission, but if you launch this with full force, then it will not spread, and but it will continue till the November. So please, it is not a few days or few months activity, but it is a 4 month complete activity to deal with the dengue fever. And dengue is one of the fever which causes bleeding, and you know that when there is a bleeding from your out of your body or somebody sees, it is a fear, it is a very dangerous situation for the patient as well as for the family. So this kind of activities uh, create a lot of tension, and the hospitals and other things are under stress. So please take care of this fever. It is not a simple fever, and the risk I have already told that it is 68, which is moderate. Then coming to the point of community. So community is, as per the TED talk, uh, Professor Merkel, uh, the community is medicine. It is a full talk which says that if community is organized around any problem, then there is no need of such big hospitals or such kind of emergencies, and community can learn, community can deal. And I quoted the example that even in the Iran war, 40 days bombing, and community was standing with the country, and I think they have done well. And there is hospitals were damaged, the doctors were killed, but even then, the Iran and the community is functioning very well. So no disease, no drug is super than the community itself. And that lecture on the TED talk is also there, which says that community is not only the group of people, but it is a medicine. And when you are with the community, then community can uh, manage the water drainage, water supply, use the bed nets, as well as they can create awareness. And the doctors should also be given a full training, and as well as a kind of research is also needed. Some plants, just like the eucalyptus, neem tree, ratjirani, and almost 60 plants are there which are mosquito repellent. We must promote it. And certain fishes, and I especially mentioned the dragonfly which eats the larva of mosquito. And in our province, it used to be immediately coming after the rain in few days, and they were just the anti-malarial insects. So on, so the certain fishes are also there. And if these trees, fishes, insects, they are used, then the dengue mosquito can be reduced, and we can reduce the uh, problem of the dengue. So I thank the DHO, was my student, as well as Dr. From Umarkot was also there, Commissioner, Deputy